Today we're going to look at a little bit of self-care for our shoulders, our arms, our chest, and our back. These areas are very much connected. Our chest and our back kind of serves to connect or root our arms to the rest of our torso. So all of these muscles have an important connection with one another. We're gonna work with the chest first, and a lot of people focus a lot of their attention on the back and the shoulders, but a lot of that tension is coming from the chest. We always have our arms in front of us when we're doing activities like driving or working on the computer, using our devices. All of these activities rely on us being in this general position, manipulating things directly in front of us. And our chest is what really holds everything together. You might not feel like you have too much tension in your chest or like you have too much muscle in your chest, but the muscle can be very tense without necessarily being bulky. So let's get in there and play with it. We're gonna start with working along our collarbone. So feel your collarbone and just feel where it is. And you want to get below your collarbone, so right where my chest starts. I'm going to start here, close to the sternum, right here, and I'm going to place my hand in this position. So I want my fingers to be as flush as possible, these three. So I'm going to bend my middle finger a little more than these other two fingers. And then I'm going to try to press with this flat point on that area. And I'll support with the other hand. So my hand is in this position, my other hand goes behind the knuckles in order to apply a little bit of pressure. So I'm not really pushing with my hands, they're just holding this in place while I lean forward. So you can do this sitting in a chair or kneeling on the ground or even standing up, but you're gonna bring your hand here, place your other hand over top, and then just bow forward, leaning into the pressure of your hand. You can come up and then again hold the next position. So you're going to work your way along the side in different spots under your collarbone. It doesn't matter exactly what spot you are, but you're looking for some tender places. And if you find a tender spot, you might want to hold it for a little while. Shiatsu is perpendicular pressure directly over the spot, not at an angle. There's perpendicular pressure, stationary pressure, so that means you're pressing straight. You're not moving around while you're doing that pressure. So I'm not digging in. So stationary pressure, perpendicular pressure, holding pressure. You're holding it for a while. You're not just pushing and moving to the next one. And concentration. So you have to have mental concentration. If you're doing this when you're not focusing on it, you're not going to get as much. It'll still help a little bit, but you're not going to get as much out of it if you're watching a show while you're doing this than if you're sitting there concentrating on the sensations that you're feeling and allowing your body awareness to guide you. So we're placing the hand here, that stationary perpendicular holding pressure as we lean forward and then coming back up and to the next spot. So I don't want to have a lot of tension in my fingers. I'm trying to make them as relaxed as possible as I work my way across the collarbone, from the center of my chest until I feel the edge of my chest or I start to feel the shoulder. So you can just pretty much work your way all the way to the end of that bone, pressing these different places and leaning into it. So try a couple of passes. Just a gentle lean. It's almost like you're falling forward slowly and catching yourself in a subtle way. Let's do the other side. Switch hands, and the same thing. You want your fingers flush, your three fingers here to be flush, and your other hand's going to support by going behind the knuckles. So I've kind of got this dome shape across here, and I'm pressing here to support. So that way I'm not pushing my knuckles back, I'm really supporting with the other hand. And if anything, this hand is doing more pressing, and the other hand is trying to stay as relaxed as possible, other than what it needs to do to keep the fingers straight. You don't want your fingertips to be getting super white when you're pressing, like that might be a little too hard. You're not trying to feel a pain. You're just looking for what you might notice as you move into these different positions. Some points might be more tender than others. Some of them might resonate. You might feel a sensation in another part of your chest or even another muscle or another part of your body. There might be some nerve sensation, some kind of sharp or pinchy thing if you hit a funny spot. But if you do find something curious here, or something that feels more intense than the other points or the other spots, you want to just kind of hang out there a little bit and hold it for a little bit longer. I found a pretty tender spot here and I can feel it in my neck. So what I can do here is actually move just subtly my neck from side to side, and I can actually feel with these fingers what reciprocal action that's creating in the muscle that I'm holding. I can tilt my head side to side or forward and back, or I could turn, and those are all going to give me slightly different stimulations to that area. Keep moving along. You can just do that if you find a spot that feels particularly tight. So we're doing 2 passes, getting all the way to the end of the bone. Don't cut it short. Make sure you get into that little dip. There's one little tiny spot here where you're really going to feel the junction between your chest, your collarbone, and your deltoid, your shoulder muscle. You really want to hold that spot, or at least work all the way to that spot. Next, what we're going to do is work down the space or the valley between our pectoral muscle, the chest muscle, and our deltoid, the shoulder muscle. I like to just let my arm relax on my lap, try to let that arm go totally limp, and you're going to start where you ended. So right in that little divot where we were just exploring, but except this time, instead of your hand facing this way, it's going to be facing this way. So I'm going to get into that groove, and then I'm just going to, this time I can lean in a little bit, but I can also move my shoulder forward and backwards subtly, or up and down, or I can just let it go relaxed. So you can work your way down, try to work through that valley, kind of right in the joint of your shoulder, until you feel like you've reached kind of a tightrope or the end there. And that's where your pectoral muscle goes across and plugs into your humerus. So do a couple passes here. It's almost like you're just opening up the space between those 2 muscles. You don't have to dig around or do anything in particular. You can just lean into it and try to visualize a relaxation of the muscle that you're touching. So when you're feeling a muscle with your fingers and you're concentrating on it with your mental control of that muscle, you have more feedback coming to your brain from 2 nervous centers. So you have the nervous system in your hand, which is perceiving the tension in that muscle through the sensation of your fingers and pressure. And then you have the sensation of the muscle. So when you have those 2 kinds of feedback that are coming together, it's called afferent feedback. So in having the hand there, it creates a more rich image for the brain in order to control the relaxation of any tense muscles. We'll do the other side now. You might move your finger around to find the space between the muscles or a spot that feels comfortable. When you're about to apply the shiatsu, you just want to hold that point steady and lean into it. Try to relax your hand and try to consciously relax the space that you feel the sensation. Once you find the spot that you want to hold, you're just going to hold stationary, perpendicular, and hold that pressure for a little bit of time. Once you've reached that corner, we did 2 of those. So next we're going to continue to work down the outskirts of the chest. So we've worked across the top, we've worked across the kind of the part of the side, so the top part of the side, which is where it connects with the deltoid. And then next we're going to get under the pectoral muscle, this little tightrope here. So this is the pec where it connects to the shoulder blade. You can definitely feel it. If you go into your armpit, you'll feel this tight little string close to the front, and then you can work your way down. For this technique, I'm not really squeezing, I'm just thinking of connecting my finger to my palm, which are on either side of the muscle. Hold and relax, and just focus on anything you're feeling or sensing, and work your way down to the next spot. So holding that position, you want it to be firm, but you want it to be gentle, not painful. If you find a tender spot, don't try to squeeze it until it hurts. Just try to find a pressure that you can relax into, but that you feel stimulated by. So you want to bring your awareness to that area with the pressure, but you want to be able to consciously relax into that pressure and not be resisting against it. So one thing to be sure when you're doing this is I'm holding my arm up here, my hands on my lap, but I don't want to be holding my shoulder up because that's going to tense this muscle. So what I want to do once I find my spot and grab it, I really want to just let my elbow drop, and I might need to raise it up when I switch to the next spot, and then let it drop, and one more. Okay, on the other side, so I put my hand on my lap, and I'm gonna find that the highest spot. It's really kind of more along the arm. You're gonna feel the deltoid, and you're gonna get under this little string here. So get the fingertips in there, wrap the palm around, give it a little bit of pressure between your fingers and palm, and then relax your shoulder and elbow. And then change positions. And just work your way down. And you'll get to a point where there's not really anything to grab on anymore, or you kind of get to the nipple area, and that's kind of where you're not going to have much more to go. So that's the bottom of the pectoral muscle. We'll go back to the top for one more pass. So find that spot, especially at the top. You got to move your elbow out of the way to kind of make room for you to grip, but then you can let everything relax without losing that muscle. And keep working your way down. Right to the edge. That's the top and outer side contour of the pectoral muscle. The next things that we really need to focus with the chest is really just opening up the main area of the chest. So we worked on the borders, now we're going to fill in within the lines. Hold my fingertips. This is more than what we were doing before. This is really arching my fingers like this. And then I'm gonna, again, try to make my fingers as flush as possible so that it's a pretty flat line there. And then I'm going to be putting them vertically along my chest. So close to the top and close to the center. And if each of my fingertips gets in between a different rib, that's great, but don't focus on that. You're just going to be pressing and then leaning into it and then coming up. So pressing, leaning into it, and up. You're gonna move to the side with your hands from the center to the outside. Once you get to the middle, you can switch sides with your hands and keep working your way through. So if you have a lot of time, and you're going to find when you get closer to the outside, you're probably going to be a little more tender, so there might be some spots that you want to hold for a while. But if you have time with this, do this part with just one side at a time. So really just exploring that area. You don't need to hold each spot for very long. You're just looking for any tenderness and any interesting sensations. And if you find anything that stands out, that's the spot that you want to spend some time holding for a little bit. So you start in the center. If you're doing both hands, you start in the center and then you work your way out about halfway across the chest. Any further than that, it's going to be awkward to keep your hands there. So you switch hands and then you keep going the rest of the way. and then you go down a little further. So you're basically going to do this twice, once high and once low. So low, you're again just pressing and leaning into it. And again, you're really not focusing on pressing hard with your fingers, you're just holding yourself up as you lean into your own hands. And once your hand position gets a bit awkward, you can switch to cross your arms over. But again, if you've got time to work with it, I recommend doing the same thing just with one hand. So that's your pectoral, your chest. This is something that you definitely shouldn't neglect, especially if you have issues, you have issues around your shoulder blades or your upper back posture, or if your upper back gets tight or doesn't have a lot of flexibility, or your shoulders are tense. This is going to be a big, really important area that a lot of people overlook and don't spend enough time on. But this is basically the antagonist to your back muscles. And if your back muscles are tight and tense and afflicted, then this guy is definitely involved in that situation. So next we're going to go and quickly work down the arms, and then we're going to do some work on the back. We basically just worked on the chest all the way to that deltoid. Now we're just going to go down the arms. This is going to be a quick pass through. We're going to do two things. We're going to go, once is going to be basically covering the radial side of the arm. Radial side of the arm is where the thumb is, so this whole kind of line here, and this is just basically, we're trying to cover half of this, half of the arm, and then the other one is the lower half of the arm, right, which is the ulnar side of the arm, the one that correlates with the pinky side of the hand. So pinky side of the hand, ulnar, thumb side of the hand is the radial side, and each of these techniques we're going to do is going to cover just broadly each of those. We can divide it up into the meridians, but this generally just covers it all. If we're working with the chest, we do want to do some work down the arms, but it might not be necessarily what we want to focus on. Start here, and you're just going to cover your shoulder with your palm, and again, it's the same as what we were doing before. You can support your elbow with your other hand, and I'm just squeezing my palm and fingers together. Taking a few squeezes, and then I'll get to my bicep, and then I'm just trying to grab my whole bicep as much as possible. If you got big arms, you can use your thumb like this instead of your palm. But again, we're not grabbing it and moving it around or massaging it or anything like that. It's just a hold and a squeeze. So first part, top of the shoulder, my arm's just resting on my lap or holding my other elbow, and I'm just squeezing. Focus is more on my palm pushing into the front of my shoulder. And then once I get past that deltoid muscle, that shoulder muscle, then I'm gonna focus my attention on the biceps. So I'm gonna turn my hand open, and then I can put my palm same position on the top of the bicep closest to the deltoid, and then work my way down, again squeezing palm and fingers together through the muscle, or thumb and fingers. So we're working our way down. We'll do two passes, and then we're going to keep going. So from here, my palm, instead of being palm up, I'm going to turn it so that my thumb is facing up, and that really puts my ulnar side of my hand in a position that I don't have to do anything funny with this arm in order to reach it. And I'm really just continuing to do that motion, just squeezing the palm and fingers together through the arm. If you're doing this right, you should see the fingers kind of automatically opening and closing as you squeeze the tendons that are controlling the fingers. Yeah, and once you get to the very end, you're just going to squeeze the thumb. So I'm just squeezing this base of the thumb and working my way to the tip of the thumb. And then after that, I'm doing the same thing, but from the index finger and a little bit of the middle finger, just squeezing to the tip of the finger. Good. And then we'll do the ulnar side after. We'll just do the other side first. So I'm, again, starting with the shoulder, just giving it a good squeeze. We'll do 2 passes of that. Squeezing between the fingers and the palm. And then turning the palm up on the knee. And then holding the bicep at the top with your hand. And then again, squeezing between the palm and the fingers, or the thumb and the fingers, depending on how much you feel you can wrap your hand around your own arm. Yeah, and you don't have to spend too much time at each spot. You can hold it for 1 or 2 seconds and then move to the next place. But if you find an area that feels particularly tender, you might want to hold it a little bit longer and just concentrate on relaxing it. So after 2 passes, we'll keep going. So instead of palm up, we're going to go thumb up and then squeeze along the forearm until you get to the wrist. So same idea, squeezing between palms and fingers, replacing the hand as you move along. And finally, we'll get to the thumb. So starting at the wrist, squeezing the base of the thumb, working your way through the thumb to the end, and then the forefinger and middle finger. So the base of the thumb again on the other side. Again, squeezing palm and fingers together to the ends of the fingers. Okay, and then the ulnar side, we're just going to reach back behind. This one is going to be really helpful to hold your elbow. So you can bring one arm over the other, hold the elbow, and then you can use that hand to push yourself so that you can reach back here. So what I'm going to do with this one is we're going to go back to this position where I'm pressing with these 3 fingers along the back of the shoulder blade. So I'm going to start kind of on the outside edge of my armpit. And this one I'm holding that position, and then I can move my shoulder a little bit, or I can just relax my shoulder, change spots and relax. If this is a tough position for you, you can also go over. Same thing, you're going over, pressing your arm a little bit, and then same thing. So holding that back of your deltoid and then relaxing the shoulder. And work your way down until you feel kind of the end of the shoulder, or wherever you feel that might be. If you find any tender spots, and there's often tender spots back there, you can just think about relaxing your shoulder and holding it for a little bit longer. Moving around when you find a spot with your shoulder might help as well. And then once you've done a couple passes there, we're going to go along the ulnar side of the arm. So we're trying to grab the triceps now. So we're going to get right up under the armpit, and I'm basically sticking my fingers into the crease under my armpit, and then again, squeezing the palm and forefingers or thumb, depending on if you feel like you can't really grab your arm. So just squeezing and then changing positions and then squeezing. And if you find a tender spot, you can hold it a little bit longer and try to consciously relax that muscle. All of these muscles we're working with are skeletal muscles, which means they're something that you can control with your thoughts, right? So the more you connect your body awareness to it while you're bringing attention to it, the more you can start to teach your body how to turn that muscle on and off on command, instead of always having it tense or not being able to control whether it's tense or relaxed. Next, we're going to work down the forearm. So same thing as we did on this side, we're just reaching a little further over palm and forefinger, or fingers and thumbs, just compressing the arm between the fingers and palm or thumb. This is usually pretty tense somewhere along that line. Basically, if you feel the ulnar bone here, so this bone, you can feel that hard bone there. You're basically grabbing around that bone. So holding. Usually that muscle just behind that bone is very tight for most people. So likely you'll find some sweet spots. Something else you can do here that I like to do is, as I'm holding and squeezing, if I find a really tender, tight spot and I'm holding it there, I can put my hand on my leg and lean into it, and I get a little more pressure from just kind of being wedged, kind of having my fingers wedged between the spot I'm holding and my thigh. Good, and working your way down. And once you're comfortable with that last position, you can work down the ulnar side of the hand. So starting at the wrist, squeezing between the palm and fingers, all the way through the ring finger and pinky finger. So again, palm, squeezing through the hand, and all the way there. And I'm showing you like this, but you can just let your arm relax and do this on your lap. The more relaxed your arm is in this when you're doing this stuff, the better. So let's do the other side. So let's do the first pass under. I'm grabbing my rear deltoid with these fingers and pressing, well, not grabbing, pressing. And then either just holding that spot and relaxing my shoulder, or moving it around a little bit if that feels good. And work your way halfway down. So if this position doesn't work for you, there's this option, and those have a little bit of a different effect to the way that your arm is being moved and held. So you can try both and you'll get a slightly different experience, or you can just go with whichever one is most comfortable for you. Just holding and working your way down. And once you start to get to the tricep, you can actually just go straight into the next part. So working the way down the tricep, squeezing with the palm and the fingers, or the thumb and the fingers. Just holding a position for a second or two, and then moving on unless you feel something particularly tight. Then you want to hold that for a little bit longer. Okay, and once you get right to the elbow, make sure you get over the elbow and you don't just stop before the elbow. It's great to work in this little nook, but now we're starting to get into some more elaborate arm stuff, and we don't want this to be a 2-hour video. So we're gonna continue down this way. So holding the ulnar side of the forearm and just squeezing palm or thumb and fingers together. So hold the spot and work your way down to the wrist. And if you find a spot that feels like it wants you to hang out there for a little bit, then just try and relax into it. Concentrate on the sensations you're feeling. Try to manually override the tension, and with your mind and mentality and mental visualization, relax the muscle. And once you get to the wrist, you're going to work your way through the wrist and fingers. I already showed you a good view of this, so I'm gonna do it with my hand down and relaxed, and I'm just squeezing the hand between the fingers and palm, working my way down all the way to the tip of the fingers. Now for the back, the focus here is going to be on the lower back. We'll do another video where we really focus on the shoulders and get into more work on the shoulder blade. But for now, let's take a look here. For the lower back, the first thing we're going to do, so there's a couple things. This is just going to be a quick gloss over, but I'm clasping my hands together like this, and I'm using the back of my knuckles in order to get the back. So clasping my hands together, and then I'm placing my knuckles on next to my spine. So I don't want to be pressing my knuckles into my spine, putting it next to it, and then I'm using this hand to pull the knuckles into the back. So I'm just pressing a point and then moving down and just working my way towards the hips. And just do 2 quick passes. And the other side. I find it easiest if the hand on the opposite side, so my left hand is going to go on the right side of my spine, and I find that gives me the most kind of leverage to press. And this might be a tough one for you to reach, to get your hands behind your back. The other option we're going to do is fingers, so this is going to be pretty low on the back. Typically for me, where I am now is right at the bottom of my ribs. So I'm basically just holding the bottom of my ribs and my thumbs pressing into my back, and I can lean back a little bit, or I can just stay there and let my thumbs do all the work. So for this one, we're going to go across the back. I'm basically bringing my thumbs into my back and then moving them sideways and just tracing a horizontal line until my thumbs kind of get to my sides. And then work your way down a little bit lower, same thing. Now it's between the ribs and the hips. This is a good one to do when you're standing for a long time and your back's starting to get a little bit sore. You can do this while you're standing. And then the last one, you're going to be right over the top of the hip bone. So you should feel the hip bone with the bottom part of your thumb, but you're pressing in just above the hip bone. If you find an area that feels particularly tender, you can hold that spot. And if you want, you can just hold it and relax, or you can try shifting your weight and moving your hips around a little bit to see if that affects anything at all. I'm again going to use this technique where I'm holding my elbow. So I'm either going to hold my elbow and press it to get over top here, or I'm going to get it under my arm, hold the elbow and press it to get across here. So for the top, I'm pressing my elbow with my opposite arm so I can reach as far as I can. And then I'm really just hanging on and letting my elbow go. So my elbow I'm just letting go and letting that hook of my arm apply some pressure. So it's really just the weight of this elbow that's creating pressure here. And I don't want to worry about going in between any bones right now or any precision for spots. I just want to hang that over. We're just doing a little general work here. You're going to work your way all the way down to where you start to feel your shoulder or your deltoid. Let's do 2 passes, just using your arm to press and then letting it relax, and then pressing again, moving to the next spot and letting it drop. Other side. Pressing with the elbow and then dropping, letting it go, letting the weight of the arm apply the pressure. So I'm not trying to dig my fingers in or anything. I'm just hanging on and letting gravity do all the work. In Shiatsu, it's not really Shiatsu if your muscles are doing more work than gravity. You're just really setting yourself up in a position in order to take advantage of the forces of nature. Okay, and then next we're going to bring the hand under the arm, and I'm pressing, pulling my arm with the supporting hand, and I'm going to pick up where I left off, so right on the shoulder blade. And again, I'm holding that position, and then I'm just letting the weight of that arm apply some gentle pressure here. So there's a lot of things we can do to get more precise in this area. This is a great way to wake it up, especially if you're dealing with something more in your lower back. You still have to address your upper back, but you might not need to put as much energy into it. Also helps in all of these to synchronize your breathing with it. So again, I'm going to do the other side. I'm bringing my hand under my arm, pressing the elbow, pulling the elbow back so I can reach, starting from the outside edge of the shoulder blade, and then just relaxing that arm and letting the weight of my arm pull myself down. Helps as you change positions, you can breathe in, and as you hold, you can breathe out. That's a good way to keep you from going too fast as well. But it's also a lot easier to relax into something if you're exhaling. Let's do one more pass here. So anytime you're working on your upper back, your shoulders, your chest, your neck, your head, all of that stuff, it's important to work on your arms. Anytime you're working on something in your back, you're probably going to have to do some work on your chest. And if you know your chest is tight, you probably do have to do some work on your upper back as well. So all of these things are interrelated. In Shiatsu, we don't separate the body into pieces. We separate them in functionality when we need to distinguish certain things. And that takes into consideration the connection that we have across muscle groups from one part of our body to an extremely distal part of the body. So there are lots of patterns like these, and we take that into consideration when we're working. So we never work on one area. Always remember, if you're working on your upper body, you're gonna wanna also clear down the arms. And if you're working on your lower body, you're gonna wanna clear down the legs as well. So thanks for tuning in, and I'll see you next time.